He's a young guy. We need to correct this for him. He's pretty desperate. I mean, he flew here from Florida. I'm in New York City, for those of you that don't know that. Hi everyone. If you have GERD or acid reflux, you are going to want to watch this video. So we have Vuk here, who came all the way from Florida to see us. And Vuk has a hiatal hernia, but he started out having acid reflux and GERD. And many people that have that condition don't know they have a hiatal hernia, or they don't even know what a hiatal hernia is. They just know that they have acid reflux, and that they were given Omeprazole or PREVACID or PRILOSEC or NEXIUM, or in Vuk's case, 15 medications. Yeah, you heard that right. He was taking 15 medications a day at one point. Is that right?
Yeah, that's right.
Since September, right?
Yeah, I mean, since 4 years ago.
Okay. So for 4 years now, and his acid reflux, is it better with the 15 medications? 50% better, 100, 70%?
I mean, it's better that I don't feel that much pain, but it's not.
Okay, so he doesn't feel too much burning unless he gets really stressed out, and his job requires him to travel a lot. So he has a stressful job. So it sounds like it does get triggered quite a bit. So I want to do this video for all of you that are out there suffering from GERD, heartburn, acid reflux. You probably have a hiatal hernia, or you don't have enough acid. I know it's hard to grasp onto that concept. We're not going to talk about that in this video because usually that's not the issue. Usually it is a hiatal hernia, especially if you're having stomach pain in here. And I've done a video on how to test for hiatal hernia without going and getting an expensive endoscopy. He had an endoscopy, and he has about 2 years ago, and he has a sliding type 1 hiatal hernia. And he said he was worried that it would go to a type 2, right?
Yeah, that's right.
So what I explained to him was, if you have a type 1 hiatal hernia, it can't go to a type 3 or 4 because those are genetic defects. Those are defects with the stomach, okay? And, so it's not going to progress to that next type, right? So 90% of hiatal hernias are type 1 sliding hernias like he has. And of those, 10% are symptomatic, only 10%. He's a young guy. We need to correct this for him. He's pretty desperate. I mean, he flew here from Florida. I'm in New York City, for those of you that don't know that. So, and he's not here for work, so he's here just to treat with us for the day. Hopefully we can get him to come back, treat a couple more times. He had asked me, how long does this take? You know, some people respond immediately. We've had some people 2-3 visits. It's made a huge difference. We have other people take 4 or 5 weeks, and some that take 2 to 3 months. So every case is different. I wish I knew ahead of time, which cases would be difficult, which wouldn't. He has a lot of pain when you touch here, like a stabbing pain. So for him on this first visit, it's going to be hard to get through a lot of that soft tissue and pull that stomach down. But I lasered him to reduce the inflammation so we can try to go ahead and eliminate the pain and the discomfort for him and get some movement of that stomach and pull it out of the diaphragm and correct the herniation. This is the only technique that corrects a hiatal hernia, except for surgery, but I don't think you want to go that route. The outcomes 5 years after surgery are not good for both laparoscopic and NISSEN fundoscopic. So we're going to go ahead and start here. Let's see first how much that sensitivity is improved. It's still there a little bit, but better. So we're going to definitely follow up with him if he lets us. He's a little camera shy, so if he lets us, we'll follow up with him and let you guys know how he's doing. We have also done a whole bunch of patient testimonials after 3-4 visits, some after 10, 7. We've done all different videos of patient testimonials to follow up with patients and see how they're doing. How are you doing so far?
Yeah, it's painful, but good.
See, I would not have been able to touch him like this without the laser. So the laser doesn't help with the hernia or the herniation of the stomach through the diaphragm, but it does reduce inflammation, muscle spasms, and pain, allowing me to get in there a little bit more on our first visit. And sometimes we have to do the laser on a second and third visit for people that are really symptomatic and in a lot of pain. Seem to be tolerating it much better. Good.
What do you think? Is it dead?
Stomach is pretty tight. We're going to do one more, and I want you to relax as best as you can. Folks, when I say this is the only technique, there are a few different ways of doing it. Some chiropractors stand at the bottom over there and pull down and tug down. I hate that method. It causes a reflex in your stomach, and you tighten up, and it doesn't work well. I've found over the years. I've been doing this 22 years. This technique works much better. You need to have the patient as relaxed as possible. So his abdominal wall here is a bit tight. And after we do one treatment, this will get less and less painful. This will loosen up more and more with each visit, okay? You hear that?
Mm-hmm.
That was your stomach pulling down. So we didn't put the microphone next to his stomach, but we've done some videos where you can hear that. It's a unique sound. It's kind of like your stomach growling, but not really. You could feel it sliding down, right? So we're all set with you for today. Why don't you go ahead, roll over to your side, stand up, take a deep breath in, just see how you feel. You might have an increase in burping, belching, even an increase in acid reflux for a few hours. Some people, though, have an immediate decrease in acid reflux. Okay, how are you feeling right now? Take a full breath in. Do you feel different? Do you feel any acid reflux right now?
No, it's just a funny feeling, like in the stomach, like a little bit uncomfortable, but I think it's normal.
Yeah.
But yeah.
It's going to be a little sore, okay? And if you are here tomorrow and you haven't flown out yet, it would not be too soon for you to treat with me tomorrow. Tomorrow's Tuesday. I'm here in the morning at 8:30. So something to consider. You could treat in the morning and then hop on a flight back. Okay. And we're going to go over some tips. I've done all these videos on tips on how to prevent re-herniating your hiatal hernia. I'm going to give him those now. And one of them you guys probably remember is rolling up a towel and putting it on a chair behind you so your posture isn't like this, but more like this. Extension. So we'll go over that now before your flight, okay?
Okay, thank you.
All right. Thanks for tuning in, folks. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.